So today I wanted to just do a quick video about DVTs and phlebitis. The reason I'm doing this is the Lord's put on my heart that I should share this. This is something I went through that I didn't, at the time I didn't see a lot of videos of people after the fact and people that kind of explain their whole experience, and I thought this might provide some comfort for people, maybe some information. So what happened is I had gotten phlebitis, which if you're not familiar, just an inflammation in the leg, swelling, itchy, and I had had that before and just ignored it, didn't realize it was a big deal. But I got it this time and it was more severe, so I went in, they scanned it, and they said you got phlebitis. What you ought to do is put a warm compresses on it, elevate it, and then take some aspirin, it should go away. And I did that. And then a month later it came back. And when it came back, I went to the emergency room because it was much more painful. And when I went there, they said, well, no, it's still phlebitis. Now, the people that ran the second scan hadn't seen the first scan, so they didn't know that it had changed. And it went from a smaller clot to a bigger clot, but it was still in a superficial vein. So as a result, they gave me the same instructions. They told me to go see my primary care physician. Had I went and saw my primary care physician, which I didn't, he would have probably looked at both scans and said, hey, this has gotten bigger. We should probably give you a blood thinner. I probably would have taken it, and this would not have become an issue. But instead, I didn't. I followed the directions. It kind of went away, and I thought everything was fine. And about a month and a half later, it came back. This time it was extremely painful. I had a hard time brushing my teeth and taking a shower and all that. I just had really favored that leg. So I went in, doctor felt it, said, look, I still think it's phlebitis. I can feel it, but let's go get a scan. And I went and got a scan, and it was definitely a DVT. And so at this point, I started reading everything I could. I could see that 10 to 30% of people die within 30 days of getting it. I could see all of the complications, post-thrombotic syndrome, where your leg just hurts so much you want to chew it off. I could see that 40-50% of people have that, and was very scared. So it really became a blessing to me because I started to focus on the risk factors and making changes in my life. I stopped smoking cigars. I was smoking a couple a week. I did that for about 7 months, and now I still smoke them, but not nearly as much. I lost 60 pounds. I've gained back a little bit, because it's been about a year and 3 months, but I lost a lot of weight. I ended up also having AFib, and they found that I had a hole in my heart, a PFO, completely unrelated. But again, it turned out to be a blessing because the treatment for a PFO, which ostensibly puts you at a higher risk for a stroke, and the treatment for a DVT that's unprovoked is the same thing. They give a blood thinner. So I was taking one medication for two issues, so I changed all these things. And at first it was painful, and I was very overweight, so I started walking. And first I had 20 minutes, and there was a lot of information out there that said in the first couple of weeks you really should take it easy, or maybe you ought to walk. They weren't 100% certain if it increased or reduced the risk. But I started off with 20 minutes, and then after I got past that, my doctor said it was okay. I went ahead and upped the walking because I wanted to try to get the maximum benefit from it, because that was the only thing I could personally do to help resolve the issue. So when I did that, I eventually got myself up to 2 hours a day. I was walking an hour in the morning, an hour at night, and I just made the time to do it. And it was right in the middle of COVID, so that made it easier. And ultimately, it never really got better. It just hardened up and calcified. And I thought it went away many times because I felt so good. But I would also have a lot of weird sensations in my legs, especially when I was walking. Sometimes it felt like I couldn't control my foot. Sometimes I would get little prickly feelings in my leg. Sometimes the pain would move up my leg, more in my groin area. And it was scary. It was very scary. And so ultimately, it also allowed me influenced me to begin to look at, kind of what I was doing in life, what my priorities were. It helped me shift that to, going back to a time in my life when I was more spiritual, more religious, more interested in learning about Jesus and serving my fellow man, and not only in my work, but also in my personal life. So, a year out, a year and 3 months out, I would make the following suggestions. Number one, if you get phlebitis, go to see your primary care doctor. It might be big enough that they may want to give you a blood thinner earlier. Two is if you get it, If it's within a week or so, a lot of times they can rotor that out, so you don't have to take blood thinners like I do for the rest of your life, and you avoid the risk of post-thrombotic syndrome. The third thing is when they do a scan, they can also do a test in the blood to look to see if it's become a DVT, because these clots can move. And I think that's what happened with mine. Is it started small, then it got bigger, then it moved into the vein or moved into the artery. I do wear the stockings, and I wear them every day, and I'm not embarrassed about it. If I'm wearing shorts, I wear it. A lot of times I wear it on both legs. I definitely would recommend you get the prescription versions where they're fitted for your legs. I would highly recommend that you walk. It was the best thing I could do for myself mentally to feel like I was doing something. I think it allowed me to have a good outcome, because today I can do everything I did before. My leg doesn't feel funky in any way. It's still swollen and it's still very calcified, but I'm back to relatively normal. And in fact, I'm much more active now because instead of hiring something out, I just do it myself, because it's good for me to get that exercise. So those are my suggestions. I hope this video is a blessing to you. Understand that it's not the end of the world, and hopefully you'll have the same outcome. But certainly don't wait. Don't do what I did and mess with it more than once. Have them look at it. Take care of it to the maximum ability that you can in terms of doing what you can to rehab and reduce your risk. And I think you'll have a good outcome. So if you have a question or comment, put it in the box there, and I'll respond to it. God bless you.